Hello, and welcome to another lecture for mental health, NUR 150 and PN 108. So today we're going to be talking about family and intimate partner abuse. Just to be clear, this is not only physical abuse, which is what everybody thinks about when you think about domestic violence and abuse. It also includes sexual abuse, emotional abuse, economic abuse, and neglect. All those are different forms of different type of abuse that we're going to be referring to today. So the epidemiology, the prevalence is that they estimate that one out of every two Americans have experienced violence in their families. It's only an estimate because they're guessing on what isn't reported. But when they say experience violence, that means not only been a victim, but also have witnessed it happening in their family or have experienced violence as the perpetrator. And the prevalence they feel may be related to the exposure to how much violence is being shown in media today. Different games, television shows, movies, books, everything. They say that it's an increased acceptance of violence and pornography in all forms of media that have led to this increased prevalence of violence in our society. And they feel by that the time a child's in 6th grade, they may have witnessed 100,000 acts of violence and 8,000 murders by the time they're 11, because that's basically 6. And I think sometimes it's more than that. And that could be by what they're seeing in the media and the games they're playing, as well as what they're experiencing in real life. So the comorbidity is something that really relates to mental health nursing. People that experience this have these secondary effects of severe anxiety or depression. Hopelessness causes this depression from being feeling trapped in these situations. Post-traumatic stress disorder, especially if you witnessed or experienced any of abuse. And then suicidal ideation. They feel hopeless. They can't get out of this situation. They don't want to be alive anymore. So some of the characteristics of the perpetrator, the people who inflict the violence, and a lot of them are bullies. That's their behavior. And they consider their own needs more important than the needs of other people. They have very poor social skills. They get extremely jealous to a point that it's pathological. For example, some people won't let their spouse leave the house for fear of another person looking at them and fearing the wife will respond and keeps her or him inside the whole time. The perpetrators use intimidation, as you see in this picture at the top right. I'm tougher than you. If you do this, this is what's going to happen. And they also control family finances. So the person is in control not only physically, but emotionally and financially as well. And a lot of perpetrators have very, very poor impulse control. They don't know how to stop once they get angry. So the one thing that's important to note that there's a lot of research that's been done that say one of the characteristics of someone who abuses someone else is that they themselves have either seen abuse as a child or been abused themselves as a child. And this is very true. From what I have seen in the patients in the hospital, I've had a gentleman come in who was suicidal, admitted to the psychiatric unit due to severe depression, wanting to kill himself. Why? He was saying that life wasn't worth living. And he attributed this to the fact that he wasn't able to see his kids. And the reason he wasn't able to see his kids was that he had been physically abusive to them. And when he was giving his history during assessment, he made it a point to say that what he did was not abuse, it was discipline. Because what he thought he was doing was much less severe than what had been done to him by his father. For example, he said that when he was a child, His father, when he misbehaved, he would actually tie him to a tree outside in the yard and beat him. And he said that at least with his children, he kept it indoors and he did not humiliate them in that way. So he saw it as an okay thing since it was better than what was done to him as a child. There's a cycle to violence and abuse, and it's starts with a tension building stage. Things seem pretty good at first in a relationship, and then all of a sudden little things will set off the abuser, so that the victim is walking around the house on eggshells, not knowing when to expect an eruption of the person's anger, and something little will usually trigger this acute battering stage where the person is being physically abused severely. And then the next stage is the honeymoon stage, meaning that the person, the abuser, is feeling guilt and remorse and actually will go and buy flowers or gifts or jewelry or clothing or give money or toys, or if it's a child or present, anything to help them feel better about what they've done. This is called the honeymoon stage, but it doesn't last for long. It slowly evolves into the tension building stage again, where the person starts feeling nervous and walking on eggshells, and little things are setting off the abuser. Now, there's characteristics of vulnerable persons' children. Usually these kids are less than 3 years old, and the reason why is they can't talk, or they don't have good communication skills enough to make clear what has been done to them. And sometimes they've been told not to tell, and they don't for fear of being injured. And there's also something just to be of note with children under 3 called the shaken baby syndrome, and you may or may not have heard of this, but it's when a person shakes an infant so hard that the brain rattles inside the skull and damages it to such degree that sometimes the child may die. And this is done often. You hear the person says the baby wouldn't stop crying, or I couldn't make the baby be good, or I couldn't make the baby be quiet. And they shake the baby so hard out of frustration and anger and not knowing how to control it that they injure the baby. Babies have been, tossed about and had trauma, and some go on to be physically abused until somebody's able to notice it or stand up or intervene. Now, adolescents are also vulnerable as victims. They tend to be rebellious and trying to find their own independence in the adolescent years. They do things, they break rules, they think they're invincible, and because of this, they tend to get into situations where discipline is necessary, and sometimes this discipline is physical by an angry parent or peer sometimes as well. There are adolescent females that are abused by their boyfriends and vice versa. So sometimes kids remind their parents of someone they don't like, and they treat the child, they may be emotionally abusive to them as well as physical abusive. They may be a product of an unwanted pregnancy, and the parent isn't sure how to deal with it, and they get angry easily. They see the child as a burden. Women are also vulnerable persons, and here's why. They can become pregnant. And this pregnancy can trigger violence. And this could be or increase violence. And the reason why is the abuser often sees that pregnancy or a new child coming as a threat. A threat to them, the relationship, a threat to their financial stability, all sorts of different things that they see it irrationally, and they get very angry about it, and it may trigger. They may not, again, it may be an unwanted pregnancy as well. But women also are victims of violence when they make a move towards independence, which means, say they realize this person has anger issues that they are with and they want to leave them, and they make some kind of statements about leaving, or and the person gets angry, and then they get, oh, well, I'll do this, I'll change, I'll do this. And the person will stay with them and wait for those changes, and they'll change, but they won't change, or not for very long. And so when they really make a move towards towards independence, such as looking for another place to live, or looking for a job, or anything that will help them survive without that person who's abusing them, that's when the person gets very angry and senses that the person will leave and becomes even more physically violent. So these are things to keep in mind when you're talking to victims of abuse, and to say to somebody, well, why don't you just leave? It's not so easy, because that could escalate the violence, and that's when a lot of women are killed, when they actually try to leave the person. The person will seek them out, and you hear stories in the news like this all the time. So older adults, they're also vulnerable. They have sometimes very poor mental health or physical health, and they become dependent on the perpetrator. So think about this. Think about a female who's 75 years old, white, living with a relative, and becomes a burden to that relative, or the person feels that they're a burden to that relative. That person, since they can't help themselves so much, they become at risk. Same thing with an elderly father who's cared for by a daughter who he abused as a child, who has these feelings of anger still inside them from when they were little and they were powerless, but now they have the power over the elderly father. And sometimes that father is then at risk of being abused. This is the same thing for maybe somebody, a female who was abused by her husband and now she is caring for him, can also trigger a situation of abuse. So as far as the nursing process and the application goes, assessment is always first. As far as general assessment, we always think about what are the physical signs, and of course that is extremely important, not only to find and do an assessment and find the physical signs of abuse, but to document it with diagrams and findings and narratives as complete as possible, but also what symptoms do they have. Sometimes during an interview, when you're assessing somebody with a history of abuse, you may notice that they are fearful. They look scared. Their eyes dart around the room. They're looking side to side. They jump if there's a loud noise or somebody comes in. They have some of those. They have stomach aches. They have headaches. A lot of different symptoms. And your book does go into more detail about that you can refer to. But when you're actually doing the interview process, make sure that the victim is alone and it's done in private. So they're more apt to tell you the story. And if they tell you the story, don't interrupt at all. Let them, even if there are pauses, use your therapeutic technique of silence and let them talk as much as they will. And just to tell the story. At the end, you can ask them questions. And when you do so, try to not be judgmental. Use a very non-judgmental tone and any way you can to make them feel more comfortable. And it's always important, again, to do a self-assessment. Look at your feelings that can cloud judgment and talk to colleagues. Like some people will say, well, I don't understand, why didn't you just leave? Or why didn't he just stop going there? Those kind of things. So try and be aware of those. In your assessment, you want to include, have this ever happened before? In an emergency room, you can see previous abuse if the person's been in for multiple fractures or head injuries. It's one of the things people look for. Violence indicators of any type, any levels of anxiety, signs of anxiety, and how they cope. Look for their flawed beliefs. See if they've been isolating through this story, you'll get some of these things. See what their individual and family coping patterns are, and see what kind of stressors are they going in their life. Are they financially stable? Are they medically unstable? What other things are going on? Are they a single parent with 6 children living in one room? To assess those things. And what are their strengths? Who do they have that are supportive of them? What kind of family support do they have? Friends or outside resources are available to them? And also to make sure there's no potential for suicide and or homicide for both the victim and perpetrator. Sometimes the victim will retaliate against the perpetrator in a violent way. And people have been brought to trial because of this as well. Also, see if there's any drug or alcohol use involved. And a lot of times, this can be the time when the most abuse happens, whether when the victim has been using alcohol, and that has been definitely something that we see in the psychiatric facility, a person who has a history of alcohol or drug abuse, and when they come home, they are physically abused while they are intoxicated. And this could happen vice versa. Somebody comes home intoxicated and physically or psychologically abuses those at home. So during the nursing process, there are many diagnoses that are evident. And risk for injury is definitely number one. Risk for violence, which is similar to risk for injury, but risk for injury just to the nature of being a victim, and pain from physical abuse, emotional abuse, fear, what's going to happen next in their life, the unknown, chronic low self-esteem, powerlessness, I'm stuck in this situation and I can't leave, and ineffective coping, not having any coping skills to handle what they're going through, or not having any support. Ineffective coping is very important. The outcome identification is number one, to get the abuse to stop, to get it to cease. So abuse cessation and protection to stop it from happening again. And then to assist the person in recovery from their abuse, from all those things that are in the nursing diagnosis category that they are subject to. So in planning, guidelines have been developed by the Joint Commission. It actually requires hospitals to develop protocols how to deal with the victims and the abusers when they come into hospitals through the emergency room usually, and it requires staff be educated in family violence and the standards of care to use. Joint Commission is now has specific guidelines to see that hospitals are adhering to these, to make sure that everybody gets the appropriate care. Also, the Nursing Network on Violence Against Women has encouraged nursing education to focus on these issues. And they feel, and they have put this out in the literature strongly, that the tolerance of violence in America must be addressed if any long-lasting changes are to be made. In our society, it is true that violence is tolerated in all areas. So implementing, as a nurse, you need to report the abuse. As a nurse that's working in an emergency or in an office, and the person comes in and is a child, you are legally mandated to report the known or suspected abuse. And you don't have to prove it. All you have to do is report it. DCFS, they will investigate it and find out if it is something that is going on or not. You also have to encourage the person to have a safety plan and crisis intervention. Let them know in counseling that nobody deserves to be hit or abused, no matter what. And to talk to them about having an escape plan with a bag and shelter identified. You can't force them to leave. You can make these recommendations about having a bag. However, sometimes if this plan is found out by the perpetrator, they can be injured. So it's always good to tell them to have another involved, whether it's the healthcare staff or a family member. Case management is usually done through community mental health centers. They have counseling, they have groups They have all sorts of supportive plans in place, and to make sure that there's a therapeutic environment for them that they're going home to. Is it economically stable? Is it socially therapeutic? Is it emotionally therapeutic? And investigate these things, implement them as we are able. Also, to provide them with empowerment, help them see that there are things they can do to care for themselves, to take care of themselves, and what they can do to keep themselves safe. And they will need a lot of health teaching and health promotion for that. So this is the end of this part of the lecture, and I would like you to refer to the YouTube identification or URL code that I'm going to post, will be posted on your Blackboard. I would like you to watch 2 different videos. One is Private Violence, which is Brianne right here, and it tells her story about her abuse and her recovery. This is about as graphic as you will see, however. And then the other one is a TED Talk about a woman's story, but she gives you a detailed account of the profile of a perpetrator in an intimate partner abuse situation. So those 2, I think, will help you put everything we've covered today in this lecture into perspective and be able to transfer it in a way that'll help you improve your learning. And that's all for today. Thank you.